Hello, and thanks for joining us for today's episode of CHS Presents Health Connect. I'm Dr. Patrick O'Shaughnessy, Catholic Health Services Senior Vice President of Medical Affairs and Chief Medical Officer. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a strong commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to take this time to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. Where you go first for your healthcare needs can mean all the difference. And as I always say, choose wisely, choose CHS. Now, with a new partnership between Catholic Health Services and Beacon Health Partners, 200 practices and 670 physicians have been added into the CHS family. And we're now able to provide both Beacon and CHS patients with an expanded network of more than 1,100 physicians right here on Long Island. So for our viewers at home, we've got a great topic today for our show, introducing the new CHS Beacon Population Health Network. We've got some exciting guests that we're going to have on shortly to share with you all that we're doing to improve the lives of those we treat. CHS Beacon's extensive network will help deliver better care to patients, as well as reduce hospital costs and readmissions. We look forward to providing Long Island with this high-performing and efficient system, and my guests today include 3 important members of CHS Beacon, including Jonathan Goldstein, the Executive Director, Doreen Tansey, the Director of Care Coordination, and Linda Iatru, the Director of Quality Assurance and Compliance. We look forward to you joining us today to learn more about CHS Beacon, a new kind of accountable care organization. So stay tuned for today's episode of CHS Presents Health Connect. Hello, and welcome back to CHS Presents Health Connect. Along with St. John's Episcopal Hospital in Far Rockaway, Catholic Health Services of Long Island announced it recently purchased Beacon Health Partners, a Westbury, Long Island-based independent physician network. This acquisition and expansion will certainly benefit our communities here on Long Island. To speak more on the topic with me today, I'm joined by Jonathan Goldstein, the Executive Director of CHS Beacon. Welcome, Jonathan.
Thank you for having me.
It's great to have you here. I'm very passionate about population health management, but before we get into that, tell me a little bit about Beacon. What is it for our viewers at home?
Okay. Beacon is an accountable care organization. We focus primarily on population health management and provider reimbursement models, with a strong emphasis on patient outcomes and quality measures. So working with our network of providers, we provide them with support, added value, where they can spend time in their practices not worrying about the administrative burdens and spending more time on taking care of their patients.
So allowing the physicians as part of the network to really focus on what they're most passionate about, which is high-quality patient care.
Exactly.
Wonderful. Tell me a little bit about an accountable care organization. What is it, how does it work, and how could that perhaps benefit our patients in the community?
An accountable care organization, like ours, partners with payers. It's an organization that's accountable for the care of a distinct group of patients. Those patients are attributed or assigned to our ACO through a process where the patients might either be assigned because they've selected one of our providers as a PCP or a primary care provider, or the payers also look at claims data to see if they visited our provider more times than, say, another provider. Through that attribution process, we have this population of patients, and then that's what we become accountable for and taking care of them, providing quality care and trying to reduce cost.
So it's really exciting because actually by being responsible for the overall care of that patient, it's not just about the episode of care, but it's everything in between. So really making sure that patients are getting the things that they need in a comprehensive way and stressing some key preventative measures and key office visits to ensure and promote health and wellness as well.
Exactly. Using population health or as a participant in these payer programs, it takes a lot of data. We access a lot of data. Using claims and clinical information, we're able to perform analytics on this data. We can identify those patients who may be in need of care, who are past due for a screening exam. And we use that information to reach out to patients, reach out to physicians who take care of those patients, and alert them to the fact that these patients are in need of care or might be overdue for a screening, many times before the physician and many times before the patient.
I think that's wonderful because, again, me as an emergency physician, I would always see a complication of care.
Right.
Someone with brittle diabetes that would come in a decompensated state, someone with congestive heart failure that would come in, again, with a decompensated state. But from what you're describing, many of these patients can be alerted, and also their physician and care teams can be alerted to say, hey, we need to get you in, let's get you in for a visit sooner, get things tuned up for you, get you feeling better, and perhaps avoid that complication of care.
Again, you're exactly right. We have a team of care managers, nurses, social workers, health coaches, who every day, all day, look at the data and interact with these patients. They identify patients who are being discharged from the hospital, who have had recent ER visits, and so forth. And they work with them to make sure that they get back to their physician as opposed to, say, an ER visit or a hospital visit. And they're able to coordinate the things that they need, whether they need services in the home, whether they need assistance getting an appointment, referrals to a specialist, things like that. So we're really reaching out to those patients and helping them avoid those situations.
So these are extenders extending the care of the physician in between visits of care. That's really, really remarkable work. Let's talk a little bit about the relationship now with Beacon and CHS and how that's evolved and where we are now and the exciting things that are ahead for our organizations.
Very exciting to be part of the CHS family.
And we are excited to have you.
And I think the ACO provides the Population Health Foundation. Right? This is something new that CHS didn't always have. With Beacon coming into the family, it provides a strong foundation. Add to that the vast resources of CHS and the knowledge and the team of people that they bring. And we're very well positioned to participate effectively in these new value-based programs that are so prevalent today.
Wonderful. And that really ties into what we've talked about real briefly already, or population health management, just for the folks at home who may be saying, well, what is that? Isn't that medicine? How is it different? Can you describe a little bit about some of the things that we do and what pop health really is?
I'll try. Again, using data and analytics, we're able to identify patients who may be at risk, whether they're high risk, they're high utilizers, or high cost. And to come back to something you said earlier, it's not about trying to prevent or limit the care. We want to provide the right care in the right place at the right time.
Correct.
Right. So by using these data points, we can identify those patients who would benefit most from these interventions.
Yeah, and if you think about it from even a public health perspective, right? We do such good work in our pediatric population, well visits, preventative screening, vaccinations, and then as we move on to begin to develop chronic disease, so many times people lose touch with their providers in their 30s and 40s, develop chronic disease, and then in their 50s and 60s have complications of care. So this really is an exciting opportunity. We're thrilled to have you as a partner within the CHS family. We know we're going to do such great work together to really achieve the triple aim, and I'll let you close with the triple aim, Jonathan.
So the triple aim, right? We live it every day. It drives everything we do at Beacon, CHS Beacon. And the triple aim is to improve quality of care that we deliver to our patients, improve patient satisfaction, and decrease costs while we're doing it.
Yeah. And ultimately, hopefully, improve the health of the population we serve.
Right.
So we always say getting upstream from disease and bending the disease curve, which we know high-quality care costs less. So, Jonathan, thank you very much for joining us today. We'll continue our discussion about the important changes that are happening in healthcare right after this. Welcome back to CHS Presents Health Connect. With the addition of 200 practices and 670 affiliated physicians through CHS Beacon, we are looking forward to expanding our network of care here on Long Island while still focusing on care management and improved performance of services. Joining me now to talk about the importance of why we are doing this for our patients is Doreen Tansey, the Director of Care Coordination for CHS Beacon. Doreen, welcome.
Thank you.
And thank you for joining us today.
Thank you for having
we
me.
wanted to talk a little bit more for our viewers at home about care management. What is it? What kind of people do you have on your staff? And if you could share a little bit about the function of what you do.
Sure, absolutely. So I like to call it care coordination because basically we are coordinating and helping patients navigate the healthcare system. Today the system is so vast and it's so difficult for patients to understand where to go for their services. So we kind of drive the bus for them.
That's wonderful. So, you know, I always use the equation in my other life of air traffic control, right?
Yes.
So it's really about breaking down the silos of care
Yes.
and coordinating that care across the full continuum so that patients know when they leave a doctor's office what their next steps are, and hopefully to avoid having them decompensate and to wind up in the emergency room. Can you share an example of how you do it and some of the people that are involved
Sure.
with the touch points?
Sure. So my staff consists of registered nurses and licensed practical nurses, social workers, and health coaches. And together, you know, we are this team that tries to tackle all these difficult patients, especially patients that are non-compliant, those that miss their visits.
Sure.
They don't take their meds, multiple issues going on with them. I can give you a great example of a patient who has CHF. Mm-hmm. Continuous in and out of the hospital.
So continuous
very difficult.
Congestive heart failure,
Yeah.
multiple, you know, exacerbations,
Yes.
winds up where I used to work in the ED.
In the ED, yes. Elderly lady, and didn't know what we could do with her, and we actually hooked her up with some telemedicine. And we actually made phone calls in addition to telemedicine to remind her to take her medicine every morning at the same time. And started to decrease and decrease and decrease. It was just... It was
So
actually wonderful.
So actually coordinated her medications. And talk a little
Yes.
bit about telemedicine. That's bringing some of the services actually into the home where monitoring can occur,
yes,
correct?
It's actually a division of CHS has telemedicine. And I actually did get to visit that, and it was remarkable. There are nurses on the back end of these beautiful screens, and it prompts them to call patients who have not checked in, whether it be daily weights or vital signs of blood pressure. And when the patient doesn't check in, the nurse will call.
Yes.
And find out, you know, how are you, Mrs. Smith? Why haven't you weighed yourself today? And interesting story, while I was watching that, a patient had to be called, and the nurse wanted to know why she had a 3-pound weight gain. Mm-hmm. She ate pepperoni pizza the night
That'll
before.
do it. That'll do it. And you know what? That's life. People will
Yes.
eat, and they should. They
Yes.
should, you know, enjoy
Yes.
life. But at the same time, what we're trying to do is to promote health. So in other words, if you're going to do that, let's think about maybe your medications maybe need to be adjusted
Yes.
for the next 1 to 2 days to help deburden some of the sodium and extra water, get you feeling better, and avoid a complication
And that's
of care.
exactly what happened. The nurse was able to contact the doctor and
Right.
make the connection and give her the proper dosing.
So as you mentioned, kind of coordinating, not just driving the bus, but really also having the people in the right seats on the bus and taking the bus where it needs to be.
Yes.
And that definitely impacts our patients and their well-being.
Yes. So we do also deal with, since I do have social work component, we deal a lot with behavioral health patients that need connection to programs, community organizations, and community programs, and it's vast array of services that we help provide connection to.
I'm glad that you mentioned that because so many other programs may not have that comprehensive
Yes.
pattern of staff that includes social workers. When you look at the social determinants of health, they are major players in disease onset, disease progression, and they have to be addressed in part of a fully comprehensive plan. So tying it in with the RNs and the LPNs, you can address the social aspects as
Yes,
well.
absolutely.
What are some of the things that you see?
Social work-wise, we do find a lot of non-compliance, refusal to care, and that's where our social workers will get involved, and through numerous conversations and building up a relationship of trust. Again, we're doing this telephonically,
Right.
and that can be difficult but they do, over time, you build up trust with the patient, and eventually you hope to make a little edge and get that patient connected with the right organization or the right physician.
Well, I know you're not just making a little edge, you're making a big edge.
We're trying.
And you are doing some great work, and I know our patients sincerely appreciate that, because otherwise they would wind up with me in an emergency, back in the ED, and perhaps even a hospitalization.
Yes.
And no one likes to be hospitalized if they don't have to. So that's really what this is about. How do we coordinate care better, keep people healthier? And that's not to say, I would have patients say to me all the time, can you be my doctor? And I would say, I'd love to, but I'm an ED doc, and I hope I never see you again, but I'm here if you need me.
Right.
So keeping them home, keeping them with their families, keeping them in the offices. How have the physicians within Beacon responded to your care coordination effort?
Pretty interesting. In the beginning, it was a little difficult to make them understand exactly what we do, but over the course of time, and I've been doing this now with Beacon for 3.5 years, and now finally we get a flow of referrals for a variety of resources, and sometimes they have no idea, and it will just say, please call patient. You know, they don't really know what does the patient need, but they know the patient needs something. Right. So it has taken off, and they are much more receptive, and they are leaning on us.
Yeah, I know
so
they
to speak,
are. I know they are.
Which is a great feeling for all of us.
It's such a vital aspect, because you know the doctors today, they're inundated with so many regulatory requirements, different aspects of documenting in the record and the electronic system. Some of that can have the effect of taking them away from the patient that they don't want to. So having this as an added bridge, as an extension, is a huge plus. So we're fortunate to have you. We're thrilled to have Beacon as part of CHS, and I want to thank you for being our guest.
Thank you so much. Thank you for having me.
We'll be right back with more CHS Presents Health Connect. Welcome back to CHS Presents Health Connect. CHS Beacon will play an important role in improving the performance metrics as well as long-term transformation and sustainability of healthcare. Joining me for a discussion on how CHS Beacon will further improve upon the quality of service we offer our patients is Linda Iatru, the Director of Quality Assurance and Compliance for CHS Beacon. Linda, thank you for joining us today. And on the segment that is most near and dear to my heart, quality. Quality and patient safety always first. Share with our viewers a little bit about how you think CHS Beacon improves quality for our patients.
Sure. Well, our goal is to improve and maintain the optimal health status of our patient population through quality, cost-effective care. In addition, we want to improve the patient experience throughout the healthcare system. How we do that is through collection of data or information. And what's so wonderful now in healthcare is that there's a lot of information out there, and there's a lot of sharing of information. So we can work with a lot more to really keep our population healthy.
No question. No question. And, you know, physician engagement in this is so important. And as I discuss this with our physician colleagues all the time, we all have scorecards. There's publicly reported data. So when I was in the emergency room, how well were my outcomes? How well were my, my patient experience measures and whatnot? Can you share a little bit about some of the measures that we track, and also how our physicians are aligned around those measures?
Yes. And, well, there are a set of measures that Medicare has identified through a lot of research that if we are able to maintain and prevent patients from becoming ill, that will generally improve the health care of the population. Some of those measures relate to prevention, such as flu vaccines, pneumovax vaccines, and these will prevent, especially for an older population.
Making sure they get their vaccination.
That's right. That's right, and really prevent any kind of pneumonia or respiratory complications. In addition, mammograms or colonoscopies, and would prevent, or early detection of cancer, which would prevent any kind of further progression of it. So, in addition,
it sounds like incorporating some of the U.S. Preventive Services Task Force recommendations in preventative testing. And how about for folks with chronic disease, like say diabetics? Are there ways that you can screen and check on how well they're doing?
Yes, absolutely. There are specific measures for diabetes, for example, and it's a blood test called the HbA1c, where they can measure the sugar level in your blood. And so that if it's done routinely, we can pick up and then work with the patient and the physician, the patient's physician, to instruct the patient on how to use their diet, how to use medication, and the importance of preventing. Diabetes has long-term complications, but if they're well controlled, we can prevent those long-term complications, which could be very debilitating.
No, I agree with you 100%, and we say this all the time. You know, if you take care of yourself, if you have a good quantitative measure of how well you're doing, and then you can change the trajectory of your disease path.
Yes.
And again, you know, as I mentioned before, the goal is to try to keep patients from seeing guys like me in the emergency room and keep them home with their families or with their primary care doctors and specialists in the offices. So that's really some wonderful work that everybody's doing. Can you share, though, a personal story maybe of a patient or an experience that has impacted from your work and quality and the outcomes that have achieved with CHS Beacon?
Absolutely. There was a patient that we identified through our data and our reports that was diabetic and also had a wound. And our nurse from care coordination team reached out to the patient, and at that time the patient wasn't as open to having, the patient didn't feel that he needed care coordination. And working with the physician, though, a few months down the line, this wound didn't heal, and the physician contacted our care coordination team, and the nurse called the patient back and found out through speaking to him, interviewing him, that he was not compliant with his diet. He didn't understand the impact the diet could have.
Right.
He was not always taking his medication, and he was a little overweight. And also what she found through a review of his medications, he was not on what we call a diuretic or a water pill, which created some swelling in his leg, which then prevented this wound from healing.
Right.
Well, within a few weeks, the wound completely healed through her intervention and through putting him back on the water pill after discussing it with the physician. And she was able to really coordinate the care with all the physicians and the patient. And this patient was forever grateful because it made such a remarkable difference in his life.
Absolutely. So again, tying it all together, physician engagement is key. And for the viewers at home, a lot of the payment methodology for physicians now is changing. And as I was taught in some of my graduate programs, now that the methodology is no outcome, no income. And so can you describe a little bit? I mean, the physicians in the network are very engaged and aligned, but actually their incentive is really built around how well they're caring for their patients.
That's right. So what we've done, we have a department, a provider relations department, that really is just focused on working and collaborating with the physician. So that what we do, we have these list of quality measures, and they go out on a monthly basis, and they can work with the physician to let them know where they are on their performance metrics. So we work with the physician and find out, are there any barriers to having that patient come in? We can assist with that. So as they improve, and we have found that we have actually gone above the 90th percentile, so we are scoring at 94%, which means that we have achieved that level of quality compared to other ACOs.
Can you share where that ranked in terms of nationally? That is very proud for the organization.
Yes,
I want you to share that.
Okay, so for several measures, because there were about 17 measures altogether, but for about 10 of those measures, we ranked within the top 10. So we're very proud of that, and we hope to continue to achieve that. And along with that, the physicians also, I find that physicians are very open, and the quality of care really speaks to them, as well as the performance measures and percentage.
No question. And I have no doubt that you'll be continually successful in this. We thank you for coming on the show today, and thank all of our colleagues at CHS Beacon. We'll be right back. Welcome back. Some final thoughts on today's topic of population health management. As published in the Institute of Medicine, healthcare has a steep curve to improve, and that is we need to provide care that is safe, timely, effective, equitable, efficient, patient-centered population health management. We are confident that CHS Beacon will help deliver that steep curve, but we also need our patients to be engaged in their care. So please do reach out to your primary care providers, get engaged with your care, ask questions, and I wish you well on your healthcare journey. If you would like to know more about CHS Beacon or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you'd like me to answer on a future show, or a topic you would like to see showcased, please give us a call at 1-855-CHS-4500, or you can drop us an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.